Hello, this is Group 1. Our title is Kick the Habit, the Impact of Personalized Education on Quitting Smoking by Nicolas, Alvera, Mercedes, Coram, Manuela, Garza, Tyler, Ritchie, and Susana, Tena. For our PICO question, it is, in adults who currently use tobacco products, how does a personalized patient education program compare to current standardized smoking cessation education material reduce tobacco usage in adults in a 12-month period? For my abstract, tobacco remains the leading modifiable risk factor to morbidity and mortality, which contributes to cardiovascular disease, pulmonary disease, and multiple cancers. Despite the efforts to reduce smoking, this remains a challenge. Our evidence-based project found the impact of using a personalized smoking cessation education program compared to the standard education to increase smoking cessation rates. A review of research and non-research articles shows how tailored interventions, behavioral counseling, individualized education materials improve quitting rates. The research supports that implementing a personalized education for adults that want to quit and are aware of triggers and factors that induce smoking. Implications are to enhance collaboration between patients and providers by using a personalized counseling sessions and behavioral change models. In conclusion, this project demonstrates the importance of having a personalized patient education approach compared to the standard education to improve smoking cessation rates and related health risks.
My name is Tyler Ritchie for Group 1. I am covering the significance of our problem for our PICO question as stated by Susana. Smoking cessation significantly lowers a person's risk of serious diseases. Smoking tobacco puts a person at higher risk of cardiovascular disease, pulmonary disease, multiple forms of cancer, high cholesterol levels, and renal disease. Tobacco products contain a highly addictive substance, nicotine, making cessation difficult for some people. Smoking cessation material is often offered to patients in a generalized standard approach. Offering patients personalized smoking cessation education and resources increase the likelihood of success for cessation. As of 2023, the incidence of tobacco usage is high, with approximately 11% of adults smoking. The Healthy Choice People 2030 goal for adults using tobacco is to reduce that number by 5%.
When analyzing the literature for all of the articles that we found, it was noted that smoking cessation is a critical public health goal, and various interventions have been studied to improve quit rates. Randomized control trials by Martinez and Webb found that combining cognitive behavioral therapy with nicotine replacement therapy significantly improved quit rates, while the e-target intervention demonstrated long-term success. Qualitative studies by Bush and Moltzer highlighted that visual aids and tailored interventions enhanced participant engagement and comprehension, making smoking cessation programs more effective. A quasi-experimental study by Papadumitru found that integrating behavioral counseling, pharmacotherapy, and support groups led to higher quit rates, particularly among mining workers, emphasizing the benefits of multifaceted interventions. A systematic review by Ravi supported further effectiveness of multifaceted support systems, such as telephone counseling, nurse education, and training programs, in increasing smoking cessation success. Case reports by Agrol and Timacri, as well as the CDC, demonstrated that family therapy, pharmacological interventions combined with lifestyle changes and patient education on cardiovascular risk played a crucial role in smoking cessation. Overall, the findings suggest that structured, personalized, and multi-component interventions are the most effective in supporting long-term smoking cessation, highlighting the importance of education, behavioral support, and tailored strategies for sustained success?
In order to answer our PICO question, we did do a systematic search using PubMed, SynHall Complete in order to gather relevant literature. We focused our studies on smoking cessation that were published within the year of 2020 to 2025. We used search terms that were included in our PICO question, like smoking cessation, quitting smoking, that also included education, patient education in the literature. Our inclusive criteria were strictly adult tobacco users. We wanted studies that compared personalized to standard education. We used peer-reviewed articles and had articles that had reportable measures. We did exclude articles that just mentioned or just focused on pharmacological treatments or had a more narrow population that were only articles just for pregnant women or just for teens. We also tried to exclude articles that were high risk on biases or had an unclear method. We did have several types of evidence to include to back up our PICO question, like randomized controlled trials, qualitative studies that included interviews, patient experiences, quasi-experimental studies that took place in workplace programs, and we used some case studies to have a more individual care outcomes. Our total articles that were used at the end were 10, 5 were research-based and 5 were non-research-based articles. The outcome of our literature review is that personalized education is more effective than standard material for smoking cessation. We found that an individualized approach increases motivation, it improves patient understanding, and supports long-term quit success. But it is also more effective when you pair it with behavioral counseling, cognitive behavioral therapy, tailored self-help tools, and pharmacological help. Our evidence-based solution is to implement a personalized education program that includes individualized quit plans tailored to a person's smoke history and readiness, to use cognitive behavioral therapy in a group or individual setting, to use visual aids to support the patient choice, to have customized self-help materials like booklets, pamphlets for both dual smokers who use electrical or regular cigars, and to have regular follow-up telehealth visits or phone visits or messaging over a 12-month period. All of this is what we found in our literature review.
The next question to be asked is, what do we do with all this information? That will be addressed through our dissemination and evaluation portion. Prior to providing any intervention, we found that it's important to do a thorough assessment of the patient. That way we can start to identify barriers such as psychological dependence and start looking for ways to overcome them. This assessment will evaluate the patient's smoking history, their nicotine dependence using the Fagerstrom test, assessing their readiness to quit based on the trans-theoretical model, and we will also use the health belief module to assess the patient's perceptions to smoking and quitting. Doing all this will help provide an understanding of the patient's challenges and motivations. Once we have a comprehensive understanding, we will be able to offer a tailored support system. This includes behavioral counseling, cognitive behavioral therapy, family therapy if indicated, and provide personalized education on the risks of smoking. We have found through research that the use of pharmacotherapy, such as varenicline and nicotine replacement therapy, has been very helpful in the patients when they're experiencing withdrawal and craving symptoms, so these will be utilized as well. To ensure continued support, we will offer access to telehealth and digital services. These allow for structured follow-ups, medication adherence, and additional counseling whenever a patient is at risk for relapse, for example. In order to evaluate the success of these interventions, we will provide follow-ups at 3, 6, and 12 months. During this time, we will have the patients self-report, and we will ask if they were able to abstain from tobacco or if they relapsed. And these answers will be validated using biochemical testing. to hold accountability for the patient and to ensure that the answers that we are receiving are truthful. And this is our reference page. Thank you very much for watching.